Um, as of noon today, we're reporting 11 new COVID-19 cases. I'll go ahead and give you the rundown of counties. So we have an additional case in each of Brown, Butte, Clay, Coddington, 2 in Lawrence, 1 in Marshall, 3 in Minnehaha, and 1 in Pennington County. We have total age ranges. We have 1 in the 0 to 19 year age group, 3 in the 20 to 29 year age group, 4 in the 30 to 39 year age group, 2 in the 50 to 59 year age group, and 1 in the 60 to 69 year age group. We have an additional 7 males and 4 female cases. We are also updating the website to denote the move from no community spread to minimal to moderate community spread for Clark, Turner, and Yankton counties. So in total, we have 101 confirmed cases as of today. That does include 1 death, as has been previously reported, and we have 34 recovered individuals. We also are updating that we have 3,478 negative tests, and that includes testing done at both our state public health laboratory, as well as Stanford and Avera laboratories and outside reference laboratories. So,
thank you, Dr. Clayton. Now we'll go ahead and open up for questions. Please introduce yourself and say what outlet you're with.
This is Morgan from the Rapid City Journal. Are any of the cases today inmates or staff at the Department of Corrections, or have any been exposed or sick with COVID-19?
This is Kim Malsom-Risden, Secretary of the Department of Health. We continue to have the original and first and only positive case in the corrections system. That is a patient at the South Dakota Women's Prison. Next question.
So there's no new inmates or staff today?
Correct.
Okay.
Gordon Richard with the Alcester Union Hudsonite. Can you tell me more about the peak, what we're expecting for the peak in South Dakota, and then what changes might be made and how we're responding at this time?
So as Governor Noem indicated at the press conference she held on Friday, we're estimating the peak could be at the end of May or early June at this point.
This is Gail Van Genren with the South Dakota Mail. Can you tell us or have a good idea of how many of our positive cases have been hospitalized?
Of the new 11 positive cases, I don't believe that any of them have been hospitalized. All of the individuals are isolated at home.
And how about the remaining cases that are the positive?
Due to the changing nature of an individual's COVID-19 infection, we do not have that information available on a ready basis. So we can report out what we know at the time of the infections or of these new cases today.
Megan Rath here with News Center 1 in Rapid City.
News Radio. I was wondering, we see that we have 34 people have recovered. Do you have a breakdown of which counties they're from that you could share with us?
We're working to add that information to our website and expect to be able to provide that breakout yet this week.
Thank you.
You're welcome.
Megan Rath here with News Center 1 in Rapid City. A question for Secretary Kim Malsom-Risden. Of the new cases in Lawrence County, the original Lawrence County case was tied to a vendor. Are the new cases within the sheriff's office as well?
I don't have that information.
Okay, and then a follow-up question to the Pennington County cases. You mentioned last week that the new cases in Pennington County that were tied to Monument Health, the caregiver. Has the investigation turned that the other people that have been infected in Pennington County are tied to that case?
So we don't, sorry, the new case is not tied to any previous cases at this point that we've been able to identify as part of our investigation.
So does that mean that they're travel related?
Or community acquired, but just not tied to the prior positive case. Next question.
This is Donna.
Michael, go ahead.
That's something that we have looked at and have not found a good way to do that in a way that would be helpful, but we'll continue to look at how that might happen.
This is
Jack
Donna from
with
the Smith News.
KVN and KOTA. Of the cases that you had from the Cancer Center at Monument Health, do you know how many of those people you have contacted, how many of them have been tested, and have any of them tested positive?
That's all part of the ongoing investigation and not something that we would release on a call. You know, all those individuals are being followed up appropriately, recommended to quarantine to home. If they are having symptoms, they are being tested and are being prioritized at our public health laboratory for testing. So the investigation is ongoing, and we are supporting further identification of any cases from that.
Any other questions?
Joseph, clarify with the Monument Health case.
Those of you who are trying to ask your questions, try again.
This is Jackie with South Dakota Public Broadcasting with a follow-up on Monument Health.
Go ahead, Jackie.
Just to clarify, Dr. Clayton, does that mean those who potentially were exposed won't be tested until they start to show symptoms?
That is correct. Individuals who are exposed to COVID-19 cases are not recommended for testing unless those individuals themselves develop symptoms. Just because a person may have been exposed does not mean that they will go on to develop illness.
This is Paul with the Groton Daily Independent. That new case in Brown County, can you tell us the age, sex, and whether it's travel or community spread?
So we are able to release that we have one case in Brown County. To help maintain confidentiality of that individual, we do release all of the case information for each of the pieces of information, so by county, by age range, and by sex, but we do not associate them. Otherwise, it would make it more easily to identify an individual in some of our communities.
Gordon Richard, has Governor Noem responded to the South Dakota Medical Association criticism recently?
This is Kim Malsom-Rice, and Governor Noem addressed that letter in her press conference on Friday. I'd encourage you to review that.
Okay.
We have time for one more question.
Hi, this is Danielle Ferguson with the Argus Leader.
Go ahead, Danielle.
Go ahead. I'm wondering if you can give us an update on testing supplies, or are they still in the steady stream? Are we still able to do more testing this week?
So we reported last week that we were able to secure needed supplies to ensure that the public health lab could continue to test for high priority populations. We're confident that our current supply will allow us to continue with that group. In addition, commercial lab capacity has come online, and we anticipate that will continue to meet the need for residents of South Dakota.